features. How many sets of valves you have? 2 or 4? 2 sets. Okay, but that's the right answer. 2 sets, right? That means how many? 4. You have 2 AV, right? And 2 semilunar that I wrote on the book, right? So, this is right atrium, right ventricle. So, these are right AV valves. Left atrium, left ventricle, left AV valve. And this is the pulmonary trunk, at the beginning of pulmonary trunk, pulmonary semilunar, and here you have aortic semilunar, you don't see that clearly. Now, left AV valve is also called mitral valve. If you see the left AV valve, it has valves like this, cusps. These are called not valve. Valve is the whole thing. Cusps. Okay. In left side, you have 2 cusps. In right side, you have 3 cusps or leaf-like structures are called cusps. So, tricuspid is the right AV valve and bicuspid is left AV valve. It has 2. This is right. Okay. So right is tricuspid and left is bicuspid. That means in left side you have 2 leaf-like structures or cusps. Left AV valve is also called mitral valve. Commonly we hear mitral valve disorder. There is a disease that is called rheumatic fever. Prolonged presence of rheumatic fever can cause the damage of the valve. Okay? Valvular disorder. This rheumatic fever can come from strep throat. Streptococcus bacteria that can cause the rheumatic fever and eventually can damage the valve. Make sense? So, if someone has prolonged rheumatic fever, usually kids, small kids between 5 and 15 years, they suffer most of the time due to rheumatic fever. Okay. Okay. Here you see the valves, 2 semilunar, 2 AV. This is bicuspid, 2 cusps. This is tricuspid. Okay, so that's the right, this is the left AV valves. Wall of the heart. In the wall of the heart, you have 3 layers. Outermost layer is the epicardium. Now, you must remember when at the very beginning I told you heart has the pericardium and that covers the heart, and pericardium has how many layers? Anybody? 2. Inner one is attached to the wall of the heart. Yeah, that is the visceral pericardium. So when we see the wall of the heart, this is the wall of the heart. First thing what you will see is the visceral pericardium. Makes sense? Because it is attached to the heart. So that is the outermost layer. visceral pericardium, which is called epicardium. Make sense? Epi. Then you have middle thick layer. So that is the epicardium, outermost, which is actually visceral pericardium. Then you have a thick muscular layer, cardiac muscle. That is called myo. Myo means muscle. Cardium. And innermost thin lining of the cavity. This is a single layer of squamous, flat cells. This is called endo. Endo means inside, you know that. Endocardium. So, epicardium, myocardium, endocardium. Sense from outside to inside. If I ask you which layer helps you to contract, helps the heart to contract? Myocardium, muscle, right? Thick muscular layer. Muscle contracts, we know that. Now, there is another clinical condition that is called myocarditis. Itis is inflammation, right? Myocarditis is what? Inflammation of cardiac muscle. Myocardium, middle layer of the wall of the heart, right? So, that can also happen due to viral or bacterial infection and can cause damage to the cardiac muscle. Okay? So if that happens, the myocardium will get weaker, right? So the force of contraction will be weak. Okay, so those are the three layers. You have seen the cardiac muscle tissue and other muscle tissues in NP1, different types of muscle tissues, right? So if you see the cardiac muscle tissue under the microscope, the most important feature is what? Thick lines. How many of you remember these thick bands? Intercalated discs, right? Intercalated discs between the fibers. And also you see striations, faint lines. And cardiac muscle fibers are cylindrical fibers, like this, cylindrical fibers. Okay? Usually one nucleus, sometimes two nuclei, not more than that. In case of skeletal, you have many. So those are the features. I mentioned what? Intercalated discs are present, right? Striations, lines, cylindrical shaped fibers. How many nucleus? One or two. Make sense? Another thing is branching. Sometimes you will see that from one fiber a branch arises and go to another fiber. So those are the features, histological features of the cardiac muscle. Histological means under the microscope, tissue under the microscope. Okay. Okay. What is important here for you to know? So this is cylindrical fiber, and this is another cylindrical fiber, next one, and intercalated discs are attaching the fibers. And in this intercalated disc, you have two types of junctions, gap junctions and desmosomes. Two types of cellular junctions are present in the intercalated disc. Gap junctions, you must remember from NP1, have many pores. That's why gap. They have many what? Channels. So, in the intercalated disc, you have many pores or holes or channels. So, the ions can quickly move from one fiber to the next. Chemicals can quickly go from one fiber to the next because the doors are open, gap junctions are there. Makes sense? Many gap junctions. So ions quickly go, and that is very important. Why? Because you know that your heart muscle fibers in a chamber must contract at the same time very quickly. Make sense? All fibers in one chamber must contract at the same time, right? So they need to talk to each other very fast, quickly. That's why there are many gap junctions in the intercalated disc. Helps to communicate between fibers. Also, inside the muscle fiber, you have many mitochondria. You see these are mitochondria? Many inside the muscle fiber. Why? You need many mitochondria. Mitochondria are called what? Powerhouses, remember? Produce ATP, energy. Your heart never rests, does it? It's continuously, right? Contracting and relaxing. When you are sleeping, your heart is not sleeping. If heart sleeps, then becomes a problem, right? What will happen? Person will die, right? Heart cannot sleep. Continuously working, right? So it needs a lot of what? Energy. So that's why you have plenty of mitochondria there. Makes sense? And around the heart muscle fiber, you have sarcoplasmic reticulum, SR, and calcium ion is stored inside the SR. Calcium is needed for contraction. Remember, calcium is needed for contraction. So that's why you have SR, those tube-like structures, sarcoplasmic reticulum, to store calcium, and you have many mitochondria. Both help in contraction. Okay. Now let's talk about the coronary circulation. You remember I said that in the wall of the heart you have a small blood vessels, right? To give oxygen and nutrition to the wall of the heart, right? Those belong to the coronary circulation. Not these large ones. These are to take the blood out in it, right? And the wall, those arteries you have belong to coronary circulation. So we'll see what are the coronary arteries and veins and their important properties. First, let's talk about the properties of the coronary arteries. This is important. This is a coronary artery. This is another coronary artery in the wall of the heart. Okay. In coronary arteries, you'll see many collaterals, lateral branches. Many collateral branches. Number one. Okay, like this. Collaterals or collateral branches. Number one. Number two property of coronary circulation, these collateral branches give branches and do what? You see these branches of collateral, they join to each other like this. Join to each other, and these are called anastomosis. Anastomosis. Anastomosis is singular. If I indicate only one, anastomosis, S-I-S. If I say many, anastomosis. Okay. So anastomosis and collaterals. Those are two important properties of coronary arteries or coronary circulation. Okay, if I ask you in the test, those are two things. This is one, this is another. Okay. Now, what's the advantage of this? What do you think? What's the benefit? See, your heart is very important organ, right? So if any blockage occurs here, if there is no collateral, what will happen? This tissue will die. Make sense? But since coronary circulation has many anastomosis and collaterals, what will happen? The blood will not be able to go here this way, but will go this way and come here. It will go this way, come here. Make sense? So it will find alternate route to reach there. Okay? So that's why sometimes you don't know that your heart coronary artery got blocked because the tissue is getting blood from alternate routes. And when big one occurs, you open the heart, you see many old, blockage there. Right? Sometimes we find old blockage, but the person didn't realize that because tissue still survived because of those collaterals and anastomosis. Right? Okay. Now, a clinical condition, if blockage occurs completely here and no collateral is here, this tissue will die here. Tissue death due to complete blockage. That is called myocardial infarction. MI. Have you heard that? MI, shortcut, myocardial infarction. You will know another name of it is what? Heart attack. Have you heard that? Heart attack? Probably you have heard that. Okay, so myocardial infarction or MI is also commonly known as what? Heart attack. Due to complete blockage and death of the tissue. Now, if the blockage is partial, like small blockage that didn't completely block the artery, some blood will go here. Make sense? Because it's not, the artery is not completely blocked, partially blocked, so some blood will go there, but a small amount. So tissue will not die, but what will happen? Tissue will suffer from lack of oxygen and nutrition. Make sense? And that will cause pain. So if the supply of blood decreases, make sense? Due to constriction of the artery or the blockage or partial blockage, so tissue will still survive but will suffer from lack of what? Yes. And the pain will be created. And that is called what? Angina or angina pectoris. Pectoris means what? Pectoral. Pectoral area is which area? Chest. You all know, right? Pectoral is major, minor. Remember those muscles? Okay. So pectoral indicates the chest, and angina indicates pain. Angina means pain. So chest pain is angina pectoris. Also called what? Chest pain. So if less blood goes to the muscle, right, that causes chest pain, what kind of medicine you should take? The medicine that will do what? Open the arteries more. Make sense? So more blood will go there. So vasodilator, right? Nitroglycerin you put under the tongue, right? That is a vasodilator. Okay, makes sense? So more blood will be able to reach there. Okay. Angina pectoris is a referred pain. we say referred pain. That means pain originates in one location, you feel it somewhere else. Make sense? So when angina pectoris occurs, pain goes to the shoulder, right? Sometimes to the limb, or even all the way to the fingers. So although the origin of pain is in the heart, right? You feel in other locations. So that is called what? What kind of pain? Referred pain. Okay, use the term. Question? No? Okay. Okay, good. So, what are the arteries and veins in the wall of the heart? Arteries, first big two arteries in the wall of the heart are right and left coronary arteries. Right and left coronary arteries. Other arteries are marginal, circumflex, and interventricular. So those are some arteries in the wall of the heart. Veins are small cardiac vein, anterior cardiac vein, great cardiac vein. Another one, write it down. It's not listed here. Middle cardiac vein. Middle cardiac vein. Okay. So small cardiac, middle cardiac, great cardiac. Okay, you can easily remember. Small, middle, great. Okay. And then you have the anterior cardiac vein, and most of these veins, they get deoxygenated blood from the wall of the heart. Arteries give oxygenated nutrition to the wall of the heart, and veins get the deoxygenated blood from the wall of the heart. And most of these veins, great cardiac, small cardiac, they give the blood, deoxygenated blood, into a short, wide vein in the back of the heart. Look at this. These are the veins, and this part in the back of the heart, this short, wide, receives blood from those veins, and this is called coronary sinus. So this structure you need to know. Coronary sinus receives the blood from the veins. So tributaries bring the blood into the coronary sinus, which is a short, wide vein in the back of the heart. Okay. Okay. So the coronary sinus gives blood to the right atrium. We know deoxygenated blood goes to the right atrium. Here you see the right and left coronary arteries first. This is the right coronary artery. This is the left coronary artery. And now see what happens to left coronary artery. Left coronary artery gives a branch that goes like this around the heart. That is called circumflex. Circumflex means circling around. Circumflex, okay? So it goes like this. This one. So this is left coronary artery here, comes down, and this is the circumflex. And this is anterior interventricular artery. So left coronary becomes two. Circumflex goes like this, and anterior interventricular in anterior interventricular sulcus. Okay. Right coronary artery in the right side, this one is a long and marginal artery. This is the right coronary. Okay, marginal artery arises from the right coronary artery. And here you see many collaterals and anastomosis. Okay. They form anastomosis that I explained you earlier. Okay. So those are the arteries and veins in the wall of your heart. This is the back. So you see short, wide vein, that is the coronary sinus. Okay. This is coronary sinus. This part receives blood from most of the veins in the wall of the heart. Okay. The same thing. Okay. So, one more thing, the heart sound. When you put the staple, right, you listen the sound, lop, dup, lop, dup. Okay? The sound of the heart occurs due to closure of the valves. When the valves close, that produces the sound, not during the opening. So, closure of the valves produce the heart sound. Okay? AV valves produce one, semilunar valves produce the other one. That's why we have two types of sound. Okay, I'll take your attendance.